It is always worrisome when your child is not feeling well, but here are some guidelines to follow to identify if your child needs to be seen by his or her pediatrician for evaluation. For infants 3 months and under, contact your pediatrician if the child exhibits any of the following symptoms: rectal temp 100.4 or higher, breathing is labored, fast, or loud, which would be if the baby is making grunting sounds, if the baby is wheezing, which is a high-pitched whistling sound heard with breathing, if you notice the skin between the baby's ribs is pulling in when the baby inhales, repeated vomiting or diarrhea and not tolerating feedings, no wet diapers for 8 hours or other signs of dehydration, which include sunken eyes, no tears when crying, increased sleepiness, sunken fontanelle or a soft spot on the top of the baby's head. Baby has increasing jaundice, which is the yellowing of the skin color or eyes, extreme irritability, and unable to soothe the baby. For older infants and children, it is best to contact the pediatrician when you notice labored breathing, symptoms of dehydration, which include no urine output in 12 hours, inside of the mouth is dry and sticky, crying without tears, pale skin, prolonged high fever longer than 5 days, worsening skin infection, severe headache and stiff neck, unable to move the head from side to side or touch chin to chest, blood noted in stool or vomit, a sudden spreading purple or red rash, increasing severe pain anywhere, or if the child is less alert, less active, and acting different than normal.